Hello, I am AARP Vice President Bill Walsh, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this telephone town hall in Spanish, press star zero on your telephone keypad now. AARP, a nonprofit, nonpartisan organization, has been working to promote the health and well being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. The good news is that we are finally seeing an acceleration of vaccine distribution. Some 73% of people aged 65 and older have received at least one dose of a COVID 19 vaccine. Still, many older adults are struggling to get access, navigating long wait times, confusing sign up systems, and in some cases, they lack transportation to and from appointments. While there are many signs we are emerging from the pandemic, we find ourselves in an in between period with challenges all its own. Those who have been vaccinated have more freedom, but what does that mean for interacting with family, including grandkids who may be back at school? Some states are lowering the age to get vaccines, but what does that mean for an older person who hasn't gotten an appointment yet? And some communities are relaxing public restrictions, so how do we stay safe these days? Today's panel of experts will address these issues and more and take your questions live. If you participated in one of our teletown halls before, you know this is similar to a radio talk show and you have the opportunity to ask your question live. If you'd like to listen in Spanish, press star zero on your telephone keypad now. For those of you joining on the phone, if you'd like to ask a question about the coronavirus pandemic, press star three on your telephone to be connected with an AARP staff member who will note your name and question and place you in the queue to ask that question live. And if you're joining on Facebook or YouTube, you can post your question in the comments. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion on the global coronavirus pandemic. We're talking with leading experts and taking your questions live. To ask your question, please press star three, and if you're joining on Facebook or YouTube, you can post your question in the comments. We have some outstanding guests joining us today, including representatives from President Biden's COVID 19 task force, the Vanderbilt University Medical Center, the University of Southern California, and the National Association of County and City Health Officials. We'll also be joined by my AARP colleague, Jean Setzvin, who will facilitate your calls today. This event is being recorded. You can access the recording at aarp.org/coronavirus, 24 hours after we wrap up. Again, to ask your question, please press star three at any time on your telephone keypad to be connected with an AARP staff member, or if you're joining on Facebook or YouTube, place your question in the comments. Now I'd like to welcome our guest. Dr. Cameron Webb is a senior policy advisor for COVID-19 equity on the White House COVID-19 response team. Dr. Webb is also a practicing physician at the University of Virginia Medical Center. Welcome to the program, Dr. Webb.
Thanks for having me. Glad to be here.
All right, we're glad to have you. I'd also like to welcome Dr. David M. Aronoff. He is the director of the Division of Infectious Diseases in the Department of Medicine and Vanderbilt University Medical Center in Nashville, Tennessee. Welcome back, Dr. Aronoff.
Thanks so much for having me on, Bill. Great to be here.
All right. Donna Benton, Ph.D., is the director for the Family Caregiver Support Center at the University of Southern California. Thanks for joining us again, Dr. Benton. All right. And finally, Lilly Kan is the Senior Director of Infectious Disease and Informatics at the National Association of County and City Health Officials. That organization represents 3,000 local health departments. Welcome back to the program, Lilly.
Thank you so much, Bill. It's great to be on.
All right. Very good. Great to have you. And just a reminder to our listeners to ask your question, press star three on your telephone keypad or drop it in the comments section on Facebook or YouTube. Let's jump right into the questions with our experts. And Dr. Webb, let's start with you. While there have been signs of improvement, the vaccine distribution process continues to be challenging for many older adults. According to a recent Kaiser Family Foundation poll, 42% of seniors who tried to get an appointment said it was difficult. And we continue to hear about long lines and confusion on where and how to sign up. What's being done to improve this?
Well, that's a great question because I've heard from my own family members and from other individuals how challenging this process has continued to be. And I think there's been some improvement, but we want to keep pressing toward the mark. And so I'll start off by saying that the key tenets here are three things. One, to increase the amount of vaccine, increase the number of vaccinators, and increase the venues for vaccination. And so if you look back to mid-January when the Biden-Harris administration started, we were sending out about 8.6 million doses of vaccine each week. And last week we sent out over 33 million doses. And so I think some of those long lines, in terms of the structural component, those are improved when we have more vaccine available, especially when you couple that with more vaccinators. And then the last thing is that we've really been pushing and calling on the states to increase the venues for vaccination, not just these mass vaccination spaces or community vaccination centers, but now in doctor's offices and federally qualified health centers, through pharmacies, and the president scaled that up from 17,000 sites to now over 24,000 sites as of this week, up to 40,000 sites by the 19th of this month. And so we're really trying to make it easy and accessible in the places that people are used to getting their vaccinations. And so we think that'll help some. And then finally, I think it's pretty important that we streamline this process of registration. And so web-based isn't going to work for everybody. So making sure that there are phone options that work, making sure it's culturally and linguistically appropriate. And so we're continuing to work closely with the states, and we're looking forward to the launch of our vaccinefinder.gov next month. And so we think that when we put all these things together, we're going to continue to make it easier for older adults and for everyone to get access to vaccines.
Okay, thanks for that. Let me ask you a follow-up question. COVID-19 has had a well-documented and tragic impact on older adults and people of color. How is the vaccine distribution sought to address this issue?
Yeah, and I touched on a couple of those points, but the main pieces, I would say, particularly around the equity dynamic, is that all of our federal channels for vaccination are designed around that concept of equity. So our federal mass vaccination sites, which are our largest throughput centers, 3,000 to 6,000 shots per day, those are centered in the communities that have the most economic disadvantage, where they can serve the most people who've been the hardest hit and at the highest risk. And in those sites alone, there are 25 different sites that we've launched so far, and they're vaccinating over 60% of folks who are receiving shots there are from communities of color. And so that's really important as we're trying to press toward that mark for equity. And then if you look at our federally qualified health centers, again, scaling that program up from 250 sites, over 400 sites now. It'll be 950 sites by the end of this month. And again, these are trusted locations for care, these community health centers. And we think that that's a key mechanism. Over 70% of the shots at those centers have been going to minority communities. And then finally, our pharmacies program, 50% of those sites nearly are located in the highest areas of economic disadvantage, the highest social vulnerability index scores. And so, again, we're centering our programs around, addressing some of those equity challenges, and that really does serve seniors, older adults in an important way, because it makes sure that, for in each of these, it's finding places to, as we say, connect them, get them a little bit closer to where the vaccine is. Instead of asking the fire to make its way to the water, bring the water to the fire. And that's kind of what we're doing.
There you go. All right. And you had mentioned vaccinefinder.gov. Can you tell our listeners a little bit about that?
Yeah, I mean, I think there was a version that was released earlier in the year, vaccinefinder.org, and it was really a site meant to consolidate, give a single place for people to come to get information about where and how to register. And so the most I can say at this point, because of course it's being built out of HHS and that's going to launch in the next couple of weeks. But it's the idea behind it is to really pull together, a single place where anyone across the country can go to start to plug in to figure out where to get vaccinated. Sometimes it's hard to find out where to start, and so we're trying to streamline and make it a little easier, both in the web-based format and telephonically. And so we're hoping that launching that is going to be important. And you probably heard that we just recently launched a public confidence campaign. We have this new campaign. If you haven't seen it, it's the We Can Do This campaign. So there are commercials, targeted advertisement, but that education component about where and how to get vaccinated is also a part of that, along with our community core that's going to be connecting folks with vaccination as well. So lots of different efforts to make sure that we're getting people to the shots they need.
Very good. Thanks for that. And a reminder to our listeners, you can also find local resources on the vaccine on AARP's website, aarp.org/vaccine info. You can just choose your state, find the rules and regulations, and also toll-free numbers there and some questions to ask as well. Dr. Aronoff, let's turn to you. We've seen a lot of questions about the different vaccines, with some people wanting to wait for one or another. Is there a reason to try to hold out for a specific vaccine? Is one better than another?
Yeah, that's really a great question, Bill. And the short answer to that is no. We're in the middle of a pandemic crisis, and we need to get people immunized. And we're in a very fortunate situation right now where we have 3 vaccines that are all doing exactly what we need them to be doing, which is that on the individual level, when you receive any of these 3 vaccines, you're gaining immune protection that will keep you out of the hospital and provide protection against dying from COVID-19. And then the other thing that we're asking of these vaccines is to induce immunity that, as more people get immunized, ends the pandemic by inducing what we call herd immunity and limiting the ability of the virus to keep hopping from person to person. And right now, all 3 of the options that are on the table in the United States are doing exactly what we need them to do. Now, some people may prefer to get a single-shot vaccine over a 2-shot vaccine, or have access to one versus the other. And those things may help drive decisions, but the answer I try to tell people is get the vaccine that you can get, unless there's any compelling reason, if someone's allergic to a component of a particular vaccine. And that's information you can find on the internet or also speaking with your licensed healthcare professional.
Okay, thanks so much for that, Dr. Aronoff. Dr. Benton, let's turn to you. What advice do you have for family caregivers who are trying to assist older loved ones in getting a vaccine appointment or getting to a vaccine location?
Thank you. The first thing is patience. It is going to, we've all learned that going online may seem easy, but sometimes you actually have to just go back online and refresh. Telephone calls are wonderful. I think the people who are on these lines, from when I've talked to many family members, they find doing the phone call is a lot easier. You have to also think of the network of where your relative, your older adult relative, what's their network? Because sometimes when you're trying to look for a vaccine, while we have these general sites, there may be something that's been expanded, like maybe at the church that your family member attends. They may be holding a vaccine clinic, or their physician may know where the nearest vaccine clinic is, or a neighborhood watch group. So work with your relative, because it may not just be these big sites, but there actually may be something where your relative is involved, and maybe they're with a local senior center that has a vaccination clinic coming up. And so I think it's communication between family members is going to be very important, along with coordination. But don't be afraid to pick up the phone. Sometimes for younger people, we're used to texting and not or going online, but a phone call is still very effective.
Well, and it's still what a lot of people want, right? They just want to be able to talk to a human and ask those questions,
Yes.
particularly when the stakes are so high.
Mm-hmm.
Well, thanks so much for that, Dr. Benton. And I'd like to remind our listeners that family caregivers can visit aarp.org/caregiving for more tips and tools to help. Lilly Kan, I'd like to turn to you now. Many students are returning to in-person learning after almost a year of virtual schooling. What are some of the safety precautions that school districts and health departments are taking?
Yeah, thanks so much for that question, Bill. So one of the top safety precautions that local health departments and school districts are taking is making sure that people, including educators and school staff, are getting vaccinated. And it was really exciting to see that the CDC announced earlier this week that nearly 80% of teachers, school staff, and childcare workers have received at least one shot of the COVID-19 vaccine. Again, that's such terrific news and really aligns with the focus that we as a nation have had in protecting our educators and school staff against COVID-19 through vaccinations. Local health departments, because they are also among the vaccinators alongside healthcare providers and, again, other people who are providing vaccinations within their communities, they're definitely involved in actually vaccinating educators and school staff. Health departments are also outside of vaccinations, working to increase their support of things like school-based screening testing in collaboration with schools. And so we see local health departments continuing to work with schools also to not only vaccinate, but support school-based screening testing, and even more generally share information about, continued community transmission and what that is looking like within communities. They are working to provide other support as schools determine how to implement CDC's guidelines for schools, such as distancing in the classroom. One of the things that we know about local health departments and schools is that even before the pandemic, the majority of local health departments were working with schools in some kind of way, and it's those relationships that they're continuing to build on to help us get through the pandemic.
Okay. Thanks for that information, Lily. Really appreciate it. And as a reminder to our listeners to ask your question, press *3 on your telephone keypad. We're going to get to those live questions shortly. But before we do, I wanted to bring in Megan O'Reilly, Vice President of Health for AARP Government Affairs, to give us an update on what AARP has been doing on the COVID front. Welcome, Megan.
Great to be with you, Bill. Thank you.
All right, nice to have you. Megan, a few weeks ago, Congress passed and the president signed another coronavirus relief bill. What's in this law that will help folks with health coverage, including COVID-19 vaccines?
Great question. AARP has been fighting to lower healthcare costs as we believe all Americans should have access to affordable coverage and the healthcare they need. We are pleased that the new law recently enacted, known as the American Rescue Plan, takes important steps to lower healthcare costs for those getting coverage in the Affordable Care Act marketplaces over the next 2 years. Specifically, the law includes new and enhanced financial assistance for people who purchase coverage on their own in this marketplace. Many people could now pay nothing for their premiums, while others could save up to thousands of dollars a year. The new financial assistance is especially important for the many of you who are 50 to 64 who pay more than other age groups for marketplace coverage and often struggle to afford your health care bills. This expanded coverage and financial assistance will also help address gaping disparities in access to quality health care. It is available now, and in most states, you can enroll or update your coverage through August 15th. And to learn more, we'd urge you to go to aarp.org/ACA. You'd also mentioned vaccines, Bill, and the rescue plan includes billions of dollars in new funding to support vaccine development, distribution, and education efforts. This is going to help vaccine supply increase and support efforts to reach those who are having trouble. For example, if you're homebound or don't have internet access. The new law also increases the child tax credit. Most important, the credit is now fully refundable and can be received as a monthly refund beginning in July. And finally, AARP has been fighting to make sure that everyone gets an economic stimulus payment, whether they are working or retired, pay taxes or do not. The new law gives $1,400 to every income-eligible individual, including those on Social Security. At the start of this week, 157 million payments have been sent out. And as of this week, the government has made more than 19 million payments, almost all by direct deposit to Social Security beneficiaries who had not already received their payment. AARP is proud to have fought for this help.
All right, Megan, thanks so much for that update. And I wonder if there are any other priorities that AARP is fighting for on Capitol Hill right now.
AARP continues to fight for the financial and health security of the 50 plus. This includes making sure that people, as they age, can remain in their homes and communities, that we're protecting nursing home residents and staff, and that people have access and can stay connected through high-speed internet. Congress will soon begin working on an infrastructure plan, and AARP will be fighting to make sure that the investments in our care economy are included in this package. This includes expanding access to services that help people live independently in their homes and communities, and providing greater assistance to the nation's over 40 million family caregivers, many of whom we know are joining us today on today's call. We'll also continue our work to lower prescription drug prices, which continue to cripple family budgets. It is a really busy time on Capitol Hill, and AARP will continue to work hard to make sure the needs of older adults across this country are a priority and that your voices are heard as we advocate on the issues that matter most to you.
Okay, thank you for that update, Megan. Really appreciate it. As a reminder to our listeners, to ask your question, press *3 on your telephone keypad. And we are going to get to those questions shortly. But before we do, I just wanted to address an important issue. We know that many of you are having challenges registering for vaccines because many places require signups through online forms. And if you don't have access to a computer, this is a real challenge. AARP wants to help. We've established the AARP Vaccine Finder Support Team to assist in these cases. So if you're listening today, and you can't register for a vaccine in your community because you don't have access to technology, please press 1 on your telephone keypad now to be added to a list to receive a phone call from an AARP staff member to help out. Again, if you're listening today and you don't have access to a computer or the internet and cannot register for a vaccine because of that, press 1 on your telephone to be added to a list to receive a phone call. When you do, you'll listen to a brief message and then be returned to this call. It's now time to address your questions about the coronavirus with Dr. Cameron Webb, Dr. David Aronoff, Dr. Donna Benton, and Lilly Kan. Press *3 at any time on your telephone keypad to be connected with an AARP staff member to share your question. I'd like now to bring in my AARP colleague, Jean Setzven, to help facilitate your calls. Welcome, Jean.
Thanks, Bill. Happy to be here for this important conversation.
All right. Who is our first caller today?
Our first caller is Roger from Maryland.
Hey, Roger. Welcome to the program. Go ahead with your question.
Yeah, I was vaccinated 2 months ago and recently spent dinner with someone who I sat next to for many hours and has tested now positive for the virus. This other person is also a senior. Do I need to quarantine, or do people around me need to be kept away because I might be able to transmit it to them, even though I probably won't get sick myself?
Right. Thanks for the question, Roger. Maybe Dr. Aronoff can weigh in on that, and Dr. Webb, if you have anything to add, you can add that as well.
Yeah, thank you for that question, Roger. So the good news is, and one of the real incentives for getting vaccinated is that provides a higher barrier to you getting infected. And so if we look at the CDC guidelines for how we're supposed to handle these kind of situations once we are immunized, the recommendations are that we don't need to quarantine and we do not need to get tested for COVID-19 after exposure to someone who turns out to have COVID-19. But we do need to monitor ourselves for symptoms. And of course, if we develop symptoms that are suggestive of COVID-19, absolutely we should start to isolate ourselves and seek testing and or medical attention, depending on how the symptoms are. Now, my own advice also is that if you know for sure that you've been exposed to somebody for a prolonged period of time who is positive, that for the next 10 days to 2 weeks, try to limit the times that you're putting yourself into the space of other people without masking or without regard to the 6-foot distance, because you want to try to limit any possibility that even if you were asymptomatically shedding virus, that could be transmitted to someone else. And so I just say do the things you're normally doing to protect others around you when you're out in public, wearing a mask in public places, watching your distance between yourselves and others, but maybe just be a little more conscious of those efforts during that week to 2 weeks after a known exposure.
Okay. And Dr. Webb, I wonder if you would just remind our listeners, many of whom are getting vaccinated, what the relatively new rules are related to interacting with people if you've had the shots.
Yeah, absolutely. And I was going to say, first and foremost, Dr. Aronoff, that was perfect. So I think that's the right advice. In terms of more broadly, the CDC guidance, the first way to think about it is that, it's continuing to evolve and change. And so you'll see that there are going to be, adjustments or new detail that's provided with these recommendations as the science continues to evolve. But the first thing is for folks who are fully vaccinated, they are able to visit with other fully vaccinated people indoors without wearing masks or without being 6 feet apart. And I think that's again, trying to make sure that we're acknowledging the science, but also acknowledging that there are some benefits to getting vaccinated. And then if you are engaging with unvaccinated people who are from at least only one other household, you can engage indoors without wearing masks or staying apart if that other household is at low risk for severe disease. So those are some of the key updates there. This is kind of the hugging guidance that they described it as from Dr. Walensky. But I think that's, as a starting point, those first sets of guidelines, those are helpful. There's also newer guidelines came just in the past week about air travel and not having the need to quarantine before or after. And so that's helpful too. And just keep your eyes peeled for it. There's going to continue to be new guidance and adjustments to the guidance in the weeks and months to come. But also as we're seeing changes in terms of disease spread or in terms of the variants, always keep in mind the better part of valor is caution. And I completely agree with Dr. Aronoff. I think the idea of making sure that you're wearing a mask when you can, keeping that physical distance, it's still helpful to keep you safe and to keep others safe.
Okay. Thank you both for that. Gene, who do we have next on the line?
Our next caller is Lisa from Nebraska.
Hey, Lisa, welcome to the program. Go ahead with your question.
Yes, sir. I am having problems in transportation to where I go get my shot, and also they told me do not reschedule any more appointments, and so I don't know. I'm just kind of lost. I haven't had a vaccine yet, so. But I'm at home. I stay at home. I'm disabled, handicapped. I'm over 50, and I have those conditions. The conditions, the pre-existing conditions. I have MS and a few other things.
Lisa, whereabouts are you in Nebraska?
I'm just having a problem with transportation.
Okay, well, let's ask Lilly Kan about your question. Lilly?
Yes, thank you so much for that question. So depending on the state, and I hear that you are in Nebraska, we know that different states and local jurisdictions are doing a number of different things to support people who may have trouble getting vaccinated, either, again, because they have trouble getting to the site or simply just cannot leave their homes. Now, this strategy does vary by state and locality. So, for example, in some states, they are working with both public and private partners to provide transportation options. They are increasingly scheduling, and this is also in collaboration with the federal government as well, to really make sites as accessible as possible. So increasing the number of sites so that it is not more than 5 miles from an individual. So there are a lot of efforts that are happening around that as well. On a more limited, but it also exists basis, there is some support in actually delivering vaccinations to people in their homes, recognizing that that is pretty resource intensive. That is happening on a relatively more limited basis than some of the other examples I've provided. And so really the first start would be to contact your state health department, if that wasn't the agency that your caller had already been in touch with, to see what the different options are. And Bill, I certainly recognize that through AARP's service, there is some support in figuring out what additional services are as well for older adults trying to actually get to the vaccines.
Right. Well, thanks, Lily, for that. And Lisa in Nebraska, if you want to just hit 1 on your phone, we'll connect you with an AARP staff member, and they will try to help you with that transportation issue that you're having. Okay, Jean, who is our next caller?
We have several questions from YouTube and Facebook, and we have one coming from YouTube from Southwest Spirit. And the question is, my 9-year-old grandson went back to school. We, the grandparents, have been vaccinated. I'm 64 with type 2 diabetes. My husband is 70 with AFib and high blood pressure. My grandson lives in 2 different households as well, one with mother, one with father. He's also around extended family. Is it safe to be able to have him back in our home and also pick him up from school at least 2 to 3 times a week, and also stay with him during the summer 2 to 3 times during the week as well?
Okay, that's a great question. Dr. Benton, do you have any thoughts on that?
Actually, I think no. I thought it was going to go to a doctor. So.
Well, that's okay. We can bring in Dr. Aronoff on that. Dr. Aronoff, do you have any suggestions for that caller?
Yeah, I mean, that's a really good question and a complicated scenario. But the thing that I really liked to hear from that question is that both grandparents have gotten vaccinated and completed their vaccine schedule, which is really important because we know that the vaccines protect our older populations from getting severely ill into the hospital and dying from COVID-19, which is really important. I think this is the kind of situation where communication is really important between the grandparents and the respective parents and the 9-year-old child to be trying to limit any extraneous interactions that can be limited so that it's less likely that the 9-year-old will become essentially infected and become a vector bringing the virus around. But going to and from school, monitoring that 9-year-old for symptoms, making sure that the parents are vaccinated, if at all they can get vaccinated, and just trying to create that bubble should allow for the grandparents to be around the grandchild, to contribute to picking up the child. I mean, this again is a situation where it probably wouldn't be best for the grandparents to be operating a carpool, shepherding a lot of children around, but being able, one of the benefits of vaccination is going to be being able to see your grandkids, but just making sure that the family knows that there are 2 people in the family who, while they are vaccinated, still have risk factors for getting sick with COVID-19, and we just want to be prudent to try to limit extra sort of things, maybe limiting sleepovers and things where they're just, it may be not essential. But that's a complicated situation, and I hope that the parents are also vaccinated.
That's a good point. Well, Dr. Benton, let me swing back to you. As a caregiving expert, I'm sure you're hearing a lot of these situations. I mean, grandparents have been unable in many cases to see their grandkids for a year or more. And now we're in this in-between phase where things are beginning to loosen up. Are there any pieces of advice you might give to grandparents contemplating reuniting either virtually or in person with grandkids?
I think especially now, and I know that I've heard more people are kind of getting together and having these parties. So I think the first thing is that we do have to, as the doctor just said, make sure that it's going to be safe for the younger child. We probably during this time, if you've been in the bubble together, then you probably are in a safer place, because everybody knows the risk factors that are going on. I think that, it might be a good time to still, I think the recommendation is that you still use masks, but maybe you're allowed hugs now. Somebody could correct me if I'm wrong. And take it slow at this point because we don't want to increase anyone's risk factor if they have any underlying conditions. But I know everybody wants to just get together and, hug each other and have some kind of celebration. And I think if you can do something that maybe is around a party, some kind of traditional thing, make a special meal together. This is a great time as we start getting back together. I think that food around the table is going to be what will bring people together again slowly.
Okay, Dr. Benton, thanks so much for that. Jean, who is our next caller?
Our next caller is Catherine from California.
Hey, Catherine, welcome to the program. Go ahead with your call.
Yes, I received the Johnson & Johnson vaccine about a month ago. And I know it's been about 2 weeks since it's been in the news that there were all those contaminated vials. I'm just wondering, do I need to be worried that there might have been contamination prior to what was reported in the news?
Dr. Webb, I wonder if you might weigh in on that.
Happy to. So want to be really clear on this. There's no reason to worry about any Johnson & Johnson products that have been delivered that folks are using currently that have been previously administered. This site where that contamination event happened was not yet approved or authorized by the FDA, and so that site wasn't. So none of the Johnson & Johnson that's been in clinics or vaccination centers came from that space, and so nothing to worry about from that standpoint. I think we feel pretty confident there. And then there's a lot that's being done with that particular plan in Baltimore to make sure that things get back on track so it doesn't mess with the broader availability of Johnson & Johnson. But as far as we know at this point, no prior contamination that's affected the other doses that have gone out.
Okay, thank you for that. Jean, who do we have up next?
Next caller is Elaine from Illinois.
Hi, Elaine. Welcome to the program. Go ahead with your question.
Yes, I wanted to know if someone is highly allergic to various medications, would this hamper it? Because my doctor doesn't want liability.
Have you had a dose of a vaccine yet?
No.
You haven't. Okay. And what have you been allergic to in the past?
Too many to mention on the air.
Okay. No problem. Well, let's ask Dr. Aronoff about what he can tell you about that.
Yeah, so really, medication allergies have not been a contraindication to getting these vaccines. It is always good to check with your licensed healthcare provider to see if there are any particular ingredients that may be in certain medications or foods or cosmetics or things that you're allergic to that may cross over with ingredients in the vaccines, which are available on the CDC website and other public spaces. But in general, what we've learned has been around anaphylaxis to these mRNA vaccines, which are the Pfizer and Moderna shots, which are very infrequent happenings in the order of somewhere between 2 and 5 events per million doses that are given. And those don't seem to be occurring in people with medication allergies per se. But everybody who gets one of these vaccines is asked to wait and be observed for at least 15 minutes. And if they do have a history of severe allergies to just about anything, they're often asked to wait for 30 minutes. And we give these vaccines in facilities that are prepared to handle it if anyone seems to be having a reaction to the vaccines. So the short answer is you should be able to get one of these vaccines. Being allergic to a regular type of medication like an antibiotic or a blood pressure pill should not be a contraindication to getting vaccinated. And if you want more information, for sure engage your licensed healthcare professional.
Well, and Dr. Aronoff, isn't it true that there's also a monitoring period after the administration of a dose just for this very reason?
Absolutely. Routinely, people get watched for 15 minutes, and then they're free to go if there's been no problems. And then for people who do have a history of anaphylaxis or severe allergy, they are often asked to wait 30 minutes just to make sure that there's no untoward events from the vaccines.
And so, would you advise Elaine to sign up for a vaccine and then simply advise the healthcare professional administering the vaccine about her past allergic reactions?
Absolutely. Everybody who is giving vaccines has been trained to be able to advise people if they have severe allergies to a food or to medications and know whether they should wait 15 minutes or 30 minutes. So that's absolutely an acceptable approach.
Okay. Thank you so much for that, Dr. Aronoff. And thank you for all your questions. We're going to get to more of them shortly. And remember, if you'd like to ask a question, press *3 on your telephone keypad. Let's turn back to our experts. Dr. Webb, we've heard a lot about the mass vaccination sites. You mentioned them earlier. They're being supported by the federal government. How is the administration supporting vaccine access for people who can't get to those sites because they're homebound, they don't have transportation, maybe they live in a rural area? How can people access the resources if they fall into those categories?
Well, a couple of ways. And you heard the reference earlier that the president announced increasing the number of retail pharmacies that are distributing vaccine. And so the idea is that by about 11 days from now, over 90% of people in this country will have one of the pharmacies within at least 5 miles of their home. So that helps somewhat for bridging that gap, for making it so that people don't have to travel across, many counties to get to a place for vaccination, but they'll have a pharmacy nearby. The other thing is, our mobile units, and that was one of the ideas that we included in the national strategy for addressing this pandemic. And so in terms of mobile units, we have mobile units that were created by FEMA, also by the Department of Defense, and then also by the VA. And we're mobilizing at this point over 500 different mobile sites to get to some of those hard-to-reach places and also to get vaccine closer to people. And so that's really important, and it's a matter of getting it as close as we can. Certainly working with states and localities, financially supporting efforts that are aimed to deliver vaccine to people who are people who use home and community-based services. So lots of different approaches. Again, this is it's inherently a local thing, but I think from the federal standpoint, we're really trying to support localities who understand the challenges their residents are facing with connecting with vaccine, and just making sure there are good mechanisms in place everywhere, whether it's through mobile units that are going around bringing vaccine to people, or whether it's mobile sites that are bringing vaccines to community-based or faith-based organizations to partner, or whether it's through these retail pharmacies that are going to be within a couple miles of your home.
And what suggestion do you make to folks in these situations to get access to those resources, the mobile units, the community-based outlets?
I think a good starting point is to reach out to your local health department and figure out what the options are in your area, because there are different strategies that are being employed in different places. But I think that very problem is prevalent across the country. There are people who fit that description in every community, and so I think just touching base with the local health department and saying what are the options there, or any aging services organization or disability services organization in your community can also help you figure out what the options are going to be locally.
Okay, and a reminder to our listeners, AARP also has state-by-state guides for accessing vaccines at aarp.org/vaccine info. Simply select your state and you'll see all the information about how to access a vaccine online, through a toll-free number, and even questions to ask your doctor. Thank you very much for that, Dr. Webb. Dr. Aronoff, there are millions of grandparents who may be caring for grandkids or live in households with multiple generations. And we talked about this issue a little bit earlier, but I'd like to put a finer point on it. If an older adult's been vaccinated but is living in a house with unvaccinated grandkids who may be going to school or doing other activities, what precautions should they be taking?
Yeah, I mean, this is an important situation, Bill, because it's hopefully increasingly common that older adults are vaccinated. And soon, I hope, we'll start to be able to vaccinate children. But right now, we're in that window period where young children are not yet immunized. And so living at home, being vaccinated, it is fine in that household for the vaccinated grandparents to not be wearing masks, but there should continue to be some guidance around the child going to school. Hopefully the school is doing all of the things necessary to risk mitigate, and that means creating distance to the extent possible between students, having students wearing masks in school, having hand sanitizer available, having barriers up, and all of those things that schools have increasingly gotten very, very good at. But again, just trying to limit extracurricular activities or not hosting a bunch of children over at the house. But, the good news is that vaccines are likely to provide important protection to the older adults in the household. And, of course, if a child who's going to school has symptoms, or even the vaccinated adults have symptoms that are suggestive of COVID-19 at any time, they should isolate from others in the household if they can and go get tested.
Dr. Webb reminded us a moment ago that many states are lowering the age of eligibility for getting a vaccine. What do we know about the efficacy of the 3 approved vaccines for children and teenagers, Dr. Aronoff?
Yeah, also a really great question. And we're hearing really good things, and there's more to come. So, for example, one of the mRNA vaccines that's made by Pfizer-BioNTech has recently released data showing really, really high efficacy in children aged 12 to 16. And the vaccine is not yet approved by FDA through an emergency use authorization for that population, but that gives us some real hope that that will be around the corner. We know that Pfizer, Moderna, and Johnson & Johnson are doing trials or have even finished enrolling in trials for even younger children, down to as young as 6 months of age. So I think that later this spring, early summer, and heading towards the school year, we're going to get a lot of news about the effectiveness of these vaccines in younger populations, and we're all optimistic that prior to the school year next year, that we'll be able to really do substantial immunizations in our younger persons.
All right. Well, thank you for that. And, we also understand that CDC just released an advisory that vaccinations for children dropped more than 14% from 2020 to 2021. And it encouraged family members to schedule well visits and keep on track with vaccinations, even beyond the COVID-19 shot. So that's an important call out for families. Dr. Benton, we've been living under the pandemic for a year, and we've all been feeling the strain, family caregivers especially. What are some practical tools and resources that people can use to care for themselves?
We really have been feeling the strain, all of us, with being socially isolated and being worried that we can harm our relative. And so right now, I think that as we move out of this pandemic, that we have to take it slow. And when I say slow, it kind of stands for, first of all, we have to have some self-care. And that starts with recognizing what are your signs of stress. And if you are feeling stressed, you have to figure out, is this physical? Is it more emotionally drained? And then you match that, you counterbalance it by maybe saying if it's more physical, you might, if you're having muscle soreness, then maybe you're going to do stuff like dance or do some soft stretching or self-massage. But if it's more of like you're feeling emotionally drained, you might do more things like laughing and journaling and talking to other people. So you're trying to match what your self-care with once you figure out what your stress signs are. The L in slow means you have to really look back and take an inventory of, during this last year, we've all gotten new information. We've met new people. You've had probably new programs that you learned about that have helped you be resilient during the pandemic. And what we don't want to do is just drop all of this new learning out of our life, because maybe there's some things that you learned during this year when you look back that can actually help you going forward. So keep those things and that new information and people and programs with you as we move out of the pandemic. The other thing for slow is really begin to organize your day so that you now begin to include at a minimum 10 minutes of just taking a deep breath. You close your eyes, you clear your thoughts, focus on your breathing, and organize your day so that you really start to take those deep breaths and get that extra oxygen and thinking and being able to relax your entire body quickly. And finally, the W in slow stands for, I found this quote that says, worry never robs tomorrow of its sorrow. It only saps today of its joy. So worrying about things at this point, let's try to recognize when we're getting worried and really try to figure out how we can look at things a little differently and what we can focus on in the positive.
Well, that's some great advice. I feel calmer already. Thank you for for that. Dr. Benton, let me pivot to a less slow topic. We heard from AARP's Megan O'Reilly a few minutes ago about the child tax credit that was part of the American Rescue Act plan. How can credits like this help older adults who may be caring for younger family members?
So my understanding of the tax credit is this is really going to be able to give back some of the money that you might have been using over and above what you might have strained your finances. And this will really give you back some money that you can use for expenses that you might have had to make choices on before when you're caring for a younger child, if you're a grandparent taking care of grandkids. And I think that the other thing is that if you think about the funds that come in, it might allow you this time to rebond with your grandchild. So maybe you can use the funds to do some kind of extra treat, like, going out for ice cream or going to a museum that maybe you can't go to, once everything is opened up safely, that may have had an entry fee. And also, kids are going to be going back to school. Your grandkids, we've used the library and we've been away, but maybe now you can buy some non-school related books that you can read together with your grandchild and that's not going to take all of the funds. So you may use some for expenses, but maybe try to use a little bit if you can to do some treats together with your grandchild.
Okay, very good. Thank you so much, Dr. Benton. Dr. Webb, I understand that you have to drop off the call to address an issue at the White House. I just wondered if you have any recommendations for the listeners who are on the line about our conversation today.
I think the main recommendation that I have is to not only make sure that you yourself are vaccinated and have had a chance, because that's so important. If you haven't had a chance yet to get vaccinated, understand that the expectation is that over the next couple of days and weeks, a lot more adults are going to be eligible for vaccinations. So we want to make sure we get you squared away first. But that said, if you have been vaccinated already, you have the potential to be one of the very best messengers that we have, who can spread the word, talk to your peers, folks who are in your social circles, and talk to them about why you chose to get vaccinated and also some of the things that it's enabled you to do in terms of engagement with family, but also just in terms of peace of mind. And, we really do regard this as a shot of hope. And so I hope that you'll be one of those ambassadors for what this vaccine actually does. As a health professional, I just remember the relief that I felt. I work in the coronavirus unit at my hospital. The relief that I felt when that second shot went into my arm, and 2 weeks later knowing, I think I have another layer of protection now that gives me some peace of mind. And so if you feel like you're in a similar situation where you have some peace of mind, make sure you share that story. You are one of our best messengers. And so, thanks for taking the time to join us today, and I appreciate you giving me a chance to chat with you.
Okay, Dr. Webb, well, you were an excellent messenger today as well. We really appreciate you having you being on the program, and good luck with whatever is percolating at the White House that is going to draw you away.
Absolutely.
Thanks again for joining us. For our listeners, we're going to get to your questions shortly. If you have a question, press *3 in your telephone keypad now to get into that question queue. Lilly Kan, let's turn to you again. We know that in some groups, such as African Americans, there's been a reluctance to take the vaccine because of historical skepticism in the medical community. What are local health departments and organizations doing to address this vaccine hesitancy?
Yeah, thanks for that question, Bill. So first, for those tuning in today who have either gotten their first dose or are fully vaccinated, I just want to say that's such terrific news and circumstances, because in addition to you protecting yourself, it's exactly what Dr. Webb said. You also have an important role to be a trusted communicator to your loved ones who are still making their decisions about getting vaccinated, to talk about what made you get your vaccination and the reasons why, as again, to support them in making their decisions. We know that as vaccine supply continues to increase, those numbers of older adults will continue to increase as well, especially, again, as Dr. Webb said, the president had recently announced that all adult Americans will be eligible to be vaccinated in the upcoming week. We, as you mentioned, Bill, certainly recognize and understand that people who have not yet decided to get vaccinated are where they are in their decision-making for many different reasons, and that there really is a lot we can do as a community to support these people. And so local health departments, with that context, they have continued to work directly within their communities or with trusted community partners and local leaders who serve and represent those communities to do things like share timely and accurate information about COVID-19 vaccines. People have continued to have a number of questions about COVID vaccines. Those questions and the specifics of those questions have evolved over time as they've gotten more information and as we continue to learn more about vaccinations. And the local health departments have also worked with community partners to make sure that that information is available in different languages that are also culturally appropriate. And so it really is an all-hands-on-deck approach to address vaccine hesitancy and build confidence. We expect that local health departments and their community partners will be a part of the COVID-19 community core that Dr. Webb mentioned earlier, and that's really focused on building a national grassroots network of local stakeholders working to encourage vaccinations through addressing hesitancy and increasing confidence. So they have worked together, local health departments and their community partners, to have those open and respectful conversations about COVID-19 vaccines, especially with communities of color and other populations, to make sure that they're heard and listened to and that those questions are addressed. And so a few quick examples, certainly recognizing that there have been a couple of recent religious holidays, it was a really great opportunity for local health departments to work with their faith-based organizations to deliver messages and answer questions. But again, faith-based organizations are just one of the many community-based organizations that local health departments are working with. And across all of those types of partnerships to reach communities of color and other communities that are diverse and also at various stages of, again, making their decisions, the focus has been on trusted messengers, making sure there is clear and accurate and concise information, and making sure that access isn't an issue.
All right. Thank you very much for that, Lilly Kan. And before we take more of your questions, we want to again offer the AARP Vaccine Finders Support Team. If you're listening today and you don't have a computer and can't register for a vaccine in your community because you don't have access to technology, please press 1 to be added to a list to receive a phone call from AARP to assist you. Again, if you're listening today and you don't have access to a computer or the internet and cannot register for a vaccine because of that, please press 1 on your telephone to be added to a list to receive a phone call from an AARP staff member. When you'll do, you'll be asked to confirm that selection and then be returned to this call. Now it's time to address more of your questions with our distinguished guest. Please press *3 at any time on your telephone keypad to be connected with an AARP staff member. Jean, who do we have next on the line?
Our next caller is Joy from Vermont.
Hey, Joy, welcome to the program. Go ahead with your call.
Hi. Well, I just wanted to say that I've certainly had very good luck with Vermont and with these vaccines, and I've gotten two of them, so I don't need any more. I just want to congratulate Vermont for doing that. But my question is, I keep hearing that we may have to get booster shots or another shot in 6 months or so. Can you tell me anything about that? I heard it on television.
Yeah, there's been a lot of talk about that. Dr. Aronoff, what can you tell us about the possibility of a booster shot for a vaccine?
Yeah, I think that's an important issue, and I thank Joy for bringing up the question. You know, right now we're really in a race to get as many people as we can immunized against COVID-19 while we are watching the spread of the virus throughout the country, including now some of these variants, some of which originated in the United States, some that appear to have come from abroad, and some of these variants are more transmissible and may even be more dangerous for people. And current evidence is that the vaccines we are rolling out right now do provide some protection and likely very important protection against getting seriously ill from these variants. But we don't know whether there are going to be variants in the future that are going to require tweaking our vaccine supply so that we're able to really induce stronger, more specific immunity against a particular variant. We are seeing good news that the vaccines that we are using induce immunity that lasts months at a time. We just heard from the Pfizer group that vaccine has immunity out at least to 6 months that seems to be very, very high. So I'm hopeful that if we do need to get booster shots that are directed at more popular or prevalent variants, that's off in the future, and we have an opportunity to get everybody immunized with our current vaccines and hopefully start to see this pandemic recede into the background. But at the beginning of this pandemic, we weren't really thinking about boosters. We were just thinking about, can we get a vaccine? Now we have great vaccines. And I think we do need to keep in mind that, yes, we may need to get boosters at some point, but I don't think we can predict that will be 6 months from now.
Okay. Dr. Aronoff, I'm curious about what level of confidence you have that the current vaccines are effective against the new variants that we're seeing popping up, it seems almost constantly. Have they been able to keep step with the changes as the virus mutates?
Yes, and that's a really important point. For example, the single-shot Johnson & Johnson vaccine has been shown to be quite effective at preventing serious illness from the variant that we've heard coming from South Africa, for example. Now, the clinical trials that were used to gain approval for the mRNA vaccines from Moderna and Pfizer were completed before we started really seeing these variants. And so we don't have as much clinical information about how protective they are, but if we look at the blood of people who have gotten those vaccines, the antibodies in their blood do seem capable of neutralizing or blocking the ability of these variant viruses to infect cells in the laboratory. And that's strongly suggestive that we will get protection from people out in the communities. I will say that that's a really good reason to complete the 2-dose schedule for those mRNA vaccines, because that second dose of either the Moderna or the Pfizer vaccine really boosts your immune system and leads to much higher antibody levels in your blood compared to even the first shot. And so we really want super high levels of antibody so that even if those antibodies are just a little bit off target for some of these variants, they're able to provide enough protection to keep us out of harm's way.
Oh, really great point. Okay, Jean, who is our next caller?
Our next caller is Scott from New Mexico.
Hey, Scott, welcome to the program. Go ahead with your question.
Hi, I think the last answered one of my questions. I have an autoimmune disease, and I've actually gotten both my vaccinations, and I'm still following the protocols of wearing a mask and washing my hands, etc. I was wondering if you knew, with the strain of the new variants that are coming out, should I continue to follow this protocol as sort of infinitum? In other words, continue it until I hear a directive that says I don't have to do that anymore, or is it safe to be in company with other people who are protected as well and not wear my mask and not follow the same protocols that traditionally I was doing prior to the vaccination?
Okay, Dr. Aronoff, can you help Scott?
Yeah, Scott, thank you very much for that question. Obviously, it's always hard over the phone to comment on very specific circumstances such as your own, but I think in general terms, now that you are fully vaccinated, you can abide by CDC guidance when you're around other people from another household who are fully vaccinated, and you could be without your mask on. If you are on medications that are suppressing your immune system, or you have an underlying condition where your care provider says your immune system is not normal or not functioning at full capacity, then you may want to be wearing a mask even around vaccinated people if there's any suspicion that the vaccines you got didn't quote-unquote take. And I would definitely say when you're out in public, still wear a mask, still socially distance. And you made a great point, Scott, which is that we're going to see more guidance, and Dr. Webb pointed to this as well, change over time from the CDC. Right now, we still have a lot of COVID in our communities, and we are seeing clearly the emergence of these variant viruses. And so the coast is not entirely clear. So we're still asking people, even fully vaccinated, previously healthy people, that when they are in public spaces indoors, like grocery stores, for example, that they should still be respecting the distance between themselves and other people and wearing their masks and doing things to limit risk. But at some point, we certainly hope that we'll get more of a green light from places like the CDC that say, these variants are under control. If you're fully vaccinated, you don't need to be wearing masks when you're in medium or large-size gatherings or in public, but we're not quite there yet.
Okay. Thank you for that, Dr. Aronoff. Gene, who do we have next on the line?
Our next caller is Golda from Mississippi.
Hey, Golda, welcome to the program. Go ahead with your question. Hi, Golda. Go ahead with your question. All right. Why don't we take another caller?
No problem. Let's go to Anola from New Jersey.
Hi, welcome to the program. Go ahead with your question.
Hi. Yes, I'm running into an issue where I'm registered on a couple of different sites. I go on the internet, and everything I do, where say, click to see, well, CVS has vaccination available, whatever. I get told no. I'm 71 years old. I have COPD. I've been diagnosed with what they say is allergic asthma due to the fact I have the allergies. I've been doing the best I can, but I can't seem to find any vaccines open. I mean, I'm on the state's wait list. I've registered with Robert Wood Johnson, which is one of our hospitals, with their group. My next step is, because I just found out about it last night, that maybe I can get something from the VA. That's going to be my next call to make to see, what their regulations are.
Right.
I need some help. I mean, I desperately would like to have the vaccine. Basically, I'm homebound, other than to go to the doctors or something that I, go to the pharmacy, pick up medication. So, I mean, and when I go out, I always wear my mask. But I'd like to be able to feel a little bit more comfortable.
Yeah, no, I understand. Perfectly understandable. Let's ask Lilly Kan if she has any advice for you.
Yeah, thank you so much for that. And one, thank you for your interest in getting vaccinated and all of the work that you've already put into it. And while we know that supply is increasingly becoming available, we know that it can still be tough depending on what state and what local jurisdiction you're in based on what supply is locally available. So the best thing that I can say is certainly continue to closely monitor. And it sounds like you do have another option of exploring whether the VA might be an option for you. And really, I think the most important thing is right now, if you've used all of these different strategies to get yourself registered and ready, then hopefully you will be well positioned once supply is available. And so I know that patients can be very difficult, especially given what your eligibility is. But I would say that continue to do what you are doing, and hopefully it will work out once again supply becomes increasingly available.
Okay, and one other resource, if you just press 1 on your telephone keypad, you'll be connected with an AARP staffer, and maybe we can help you make those connections in New Jersey. All right, Jean, who do we have next on the line?
Our next caller is Audrey from Minnesota.
Hey, Audrey, welcome to the program. Go ahead with your call.
Okay, so once a person has the COVID and has all the symptoms, and they're quarantined for 14 days, as the CDC has expected them to do. Okay, so now, should they get vaccinated, and how long after having it? Should they get vaccinated? And during this time of having the COVID, can they expose somebody, and then those people have to go get tested after how many days of exposure?
Okay. A few good questions there. Let's ask Dr. Aronoff to weigh in.
Yeah, Audrey, thank you for that set of questions, which are really, really important. So first of all, for people who were able to stay at home and weren't hospitalized due to COVID-19, they really become no longer contagious after 10 days have passed beyond the onset of their symptoms, assuming that by 10 days they're no longer having fevers and the majority of their symptoms are clearly getting better or on the way to recovery. So by day 14, in the example that you gave, Audrey, then you're not considered to be contagious anymore. Now, we don't really know the strength of immune response that every individual person gets after they've been infected with the SARS-CoV-2 virus and had COVID-19. And while it's clear that people who have had COVID-19 have some immune protection against reinfection, that does seem to vary from person to person and probably is dependent on how strong of an immune response they mounted in the first place. And because of that uncertainty about just how robust their response was to the infection, we are really asking people to please get vaccinated after they've fully recovered, because the great thing about the vaccines is that the vaccines are not giving you COVID, but they are informing and educating your immune system to really specifically develop an antibody response against one part of the virus that is critical for infecting our cells, which is we sometimes refer to as the spike protein on the virus. It's sort of like the Velcro that the virus uses to stick to our cells and cause infection. So the vaccines really are good at making sure that we have a very strong immune response against viral infection. And we're asking people who have recovered from COVID to go ahead and get that boost of immunity with the vaccine. Now, how long you wait can be to some extent up to you. In general, we feel like people who have recovered from COVID have at least 3 months of protection against reinfection. So if somebody feels more comfortable waiting up to 3 months before starting on a vaccine schedule, that is perfectly acceptable. On the other hand, if somebody is eager to get vaccinated or their case of COVID was really mild or even asymptomatic and there's really uncertainty about their immune response, then for sure you can get vaccinated once you've fully recovered from your COVID, you're no longer feeling sick, and you're really back to normal. Then if that happens sooner than 3 months, which hopefully it will, then you're clear to get vaccinated.
Okay, Dr. Aronoff, thank you very much. And thanks to all of our panelists for answering the questions. It's been a really informative discussion. Dr. Aronoff, Dr. Benton, and Lilly, I wonder if you have any closing thoughts or recommendations that our listeners should understand most from our conversation today. Dr. Aronoff, you had the mic, so why don't you start us off?
Yeah, thank you very much, Bill. And just again, thank you to you and AARP for having me on to today's show. And I think I would just like to underscore the importance throughout this pandemic that every one of us as individuals has played to protect ourselves and people around us. And one way that we can really play a leading role right now is not only to get ourselves immunized, but to encourage our friends and family to do the same. And I'm really delighted that AARP is going to such great lengths to help people understand how they can find vaccines nearest them.
Okay, thanks so much, Dr. Aronoff. Dr. Benton, any closing thoughts or recommendations?
Well, I want to say again, thank you for inviting me again. Dr. Aronoff really said everything I was thinking. And I would just add, keep up the good habits of washing our hands and enjoy this bubble that we have of a little more social distancing.
Okay, thank you so much, Dr. Benton. And Lilly Kan, any closing thoughts or recommendations?
Yes, and I similarly echo Dr. Aronoff and Dr. Benton in thanking you all for having me on today. In addition to all that your callers are doing to protect themselves through vaccination, social distancing, and masking, just thank you to you all on the line for your patience and your perseverance. We know that things are improving. We know that we still have a ways to go, and you all have had such an important part in the work that we all do to get through this pandemic. So thank you for that.
Okay, and thank all of you again, and thank you to our AARP members, our volunteers, and our listeners today for participating in this discussion. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus and prevent its spread to others while taking care of themselves. All of the resources referenced today, including a recording of today's Q&A event, can be found at aarp.org/coronavirus, starting tomorrow, April 9th. Again, that web address is aarp.org/coronavirus. Go there if your question was not addressed, and you'll find the latest updates, as well as information created specifically for older adults and family caregivers. We hope you learned something that can help keep you and your loved ones healthy. Please join us again tonight, April 8th at 7 p.m. for a special live event in English and Spanish, Coronavirus and the Latino Community, Safety, Protection, and Prevention. Thank you and have a good day. This concludes our call. All right, well, I want to thank our experts if they're still with us. Thanks so much.